Hey YouTube, it's your girl OoohLuLaDr.Henderson, and I'm coming to do the second part of my first year of dental school. So hopefully this won't be too long, but it probably will. So I'm going to separate part 2, spring semester, with summer. But I'm probably going to do, like I said, 2 videos. So this is part 2 spring semester, and it's like a 2.0, no, 2.5. Okay, it's a 2.5, so it's like a half of the second semester, and then I'm going to mix summer and with the second half of spring. It's going to be long. If you missed my first part, or part 1 of my dental school career, I guess my first semester of dental school, then I'm probably going to try to put the link somewhere in here. If not, it's going to be down below. The link should be down below. So the first thing I want to say is about second semester, or spring semester, of my first year of dental school. And we had a total of 9 classes. Plus the clinical observations that we had to do. And I'll explain all that, but it was a total of 21.5 hours. Okay, so we took removable slash fixed prosthodontics, removable slash fixed prosthodontics, but it's also like an intro to pros class. Dental materials with the lecture and lab, operative dentistry, occlusion, oral diagnosis, intro to periodontics, evidence-based decision-making 1. I think we have to take that for like 3 or 4 semesters. Physiology and microbiology, which was with a, lecture and lab. Phys was worth the most. I don't know why I can't talk today. Phys was worth the most, and then I think it's micro after that, and then dental materials, and then the rest of the classes were like 1 credit. I know it sounds bad, but even that 1 credit really matters. So I guess we'll get into the nitty-gritty of dental school. I think I'm going to start just talking about the 2 science courses, and then split the dental courses with like spring and summer. So I want to do, okay, so physiology. I used to love phys until I came here. I don't know what's the difference between undergrad, grad school, then I get here, and I'm like, why? Just hang me or do something, because anyway, when I first started, it wasn't really bad at all. I won't say it was not bad at all, but the way they did exams, it was split into, I want to say, 6 units, and the 6 units were neurophysiology, endocrine and reproductive physiology, muscle and cardiovascular physiology. Unit 4, body fluids, renal and acid base. Unit 5, pulmonary physiology. And then Unit 6 was the gastrointestinal physiology. The hardest ones, I would say, were, I'm going to say it was renal and pulmonary. Like, those are like the worst exams. And then the way that they do it is based off of how many hours that the professor teaches. So each professor had a unit. Each professor in the physiology department had their own individual units. And the renal and pulmonary were the worst. I think because they had the most amount of hours that we were taught, and so it was more information, and that's the way the exams were made. And then the exams were based on like I said, how many hours you were taught. So how many hours you were taught was based on how many questions you have per exam. So say you were only taught 3 hours on a unit, that would be like 15 questions. But if you were taught like 12 or more hours, that would be between like, maybe 50 to 60 questions or more. So it was based off that. And I think that's why this course was a little harder to me, because I wasn't used to being tested in that way. So like if you only have 15 questions, you really can't miss that many for the exam. So with Phys, I say don't take it by like as a grain of salt, because it really matters. Like every test counts. So if you do not do well on one of the major tests, then that means you need to do like really well on the other exams. No quizzes, no labs for Phys. So do we have quiz? I don't think we had quizzes for Phys. So just study your butt off and do well on exams. Moving on to microbiology. This is a course that you're gonna love to hate. Like, I'm gonna say that it's very interesting, but it's tedious. Like, you have to know a lot of information, and it's very specific information. So for microbiology, we had 4 exams and 6 quizzes, as well as like an unknown report that was from lab. So the exams were like so crammed. I guess it was kind of in units, but we did it based off of bacteria and viruses. So I think we started off with learning about like the basic breakdown of bacteria, and then from there we actually learned about different bacteria, like the gram-positive, gram-negative, plus more, a lot more than that. And then moved into oral micro, and then viruses. So from start to finish, it was a lot of information, but it was interesting information. So you're not like sitting in class bored, like I've learned this 1,000 times, because you haven't, because there's so many different bacteria out there that are like, that can kill you. Yeah, it can kill you. So it keeps you alert, and things you never thought that you would learn, you learn in micro. So I enjoyed micro thoroughly, but it's not an easy class whatsoever, because the information is so important. Every detail is important, but good stuff. Now let's get back into the dental topics or subjects. I think we're going to start with the clinical observations, because it was like 0.5 credit hours, but it still counted as a grade. So basically, we were assigned different clinics as D1s to just go and observe, because they want us to kind of be ready and know what's going on in the clinic when we actually get there. So I think for spring, I might have 2 or 3. I think I had like oral surgery and orthodontics. Oral diagnosis was a class that is very helpful in terms of you learning how to assess a patient, how to get to know your patient, how to get information from your patient. It's pretty much how you get the detailed history of your patient, the ins and outs of your patient. This also tells you the main reason why your patient's coming in, and you have to get that detailed information of their verbatim, what they say verbatim, and that's called the chief complaint. So it's in the patient's own words. You also do intraoral examinations and extraoral. I cannot talk. That was wrong. Extraoral examinations. So intra, inside the mouth, extra, outside. I'm not joking. Outside the mouth, and in the facial area. So you kind of feel around and kind of see what's wrong or what's going on with the patient to make sure everything is fine. But this class isn't hard. It's just it's basic knowledge of what you'll need throughout the rest of your career as a dentist, even as a dental student and as a dentist, because you need to get the information before you actually start working on your patient. You need to get this information every time the patient comes in. So, I mean, this class is very important. It wasn't a hard class as long as you read your notes. And okay, so intro to periodontics. This is going to be a class that is going to be difficult for some, but I don't think this class was as difficult as some of my classmates may have thought it was. But this is a class you're going to have for 3 spring semesters in a row. Well, it's only 4 years, so 3 spring semesters. And that's at Howard. I'm not sure how other schools do it, but they kind of add information as you go. This professor in particular gave a lot of reading assignments. So if you did not stay up on the readings and wait to the last minute for exams, it was hard for you to catch up. And I forgot to mention that for all dental classes, there was only a midterm and a final, except for dental materials, and I'll talk about that later. But all the other dental classes, there's only a midterm and a final. No quizzes, nothing. You just had to pass. Well, one class they have quizzes, but for the most part, no quizzes. Just midterm, final. Can't fail. With the final weighing the most. So, but intro to perio, not a bad class. Stay up on the readings. There is a lot of reading. So study information and be able to retain it for the exams, and you're good. And the last one I'm going to talk about in this segment is the intro to prosthodontics. And prosthodontics is a branch of dentistry concerned with the design, manufacture, and fitting of artificial replacements for teeth and other parts of the mouth. So pretty much you're bringing a patient's smile back through like partials, dentures, implants, the works, those kind of things. So this course to me was pretty difficult at first because I really didn't know what, I mean, I knew what prosthodontics did, but I didn't know in detail of what they did. And mind you, this is an intro course, which will be followed up by in the fall. So we're just learning the basics. So I was like lost at first, but then as I kind of gradually understood the concepts in my other dental classes, then it kind of like brought everything together. So in the beginning in this class, I was totally lost, didn't know what was going on. But by the midterm, I started wrapping my head around the information. So I will say that this class was probably one of my harder dental classes until I understood the information and the material that we were given. So in the end, I mean, I did really well in the class, but in the beginning, it was kind of difficult. So make sure you get with people. If you don't understand, get with your professor. They'll break stuff down for you. Luckily, the professor we had for this class, she was able to meet us after school for the people who didn't understand it and kind of re-evaluate the information. And so we could get it and grasp it and not have to worry about it anymore. So ask for help. So remember to stay tuned and watch for my second half of this semester, the spring semester. So I'm going to do dental materials, occlusion, and operative in the next video / summer. So operative continued from spring to summer, and it's going to continue into the fall. So that course is very meticulous, and you need to know like all the information. So just stay tuned, and I'll give you more information on these classes. Thanks for watching.
Hello, Mr. Sunshine, you know who you are. I be wondering about you, twinkle little star. Like how you make me feel the way I do. Your energy is crazy, baby.